Hello friends, I'm Dr. Swati Kanakia, Pediatric Hematologist-Oncologist from Mumbai. Having someone you know who has cancer is a very traumatic experience. On top of which, if the doctor tells you that there are different procedures which have to be done, including a lumbar puncture with intrathecal chemotherapy, it can get even scarier. In this video, let me take you through what is intrathecal chemotherapy, why do we want to do it, how is it done, and what are the precautions. So let me take you through quickly through a little bit of biology. The brain and the spinal cord from the outside, as you see, are covered by the skull and the vertebral column. Inside that, there is a thick fibrous covering which is called as the dura mater, after which is the arachnoid matter. Next comes the pia mater, which actually is like a cling film and which kind of covers the brain as well as the spinal cord. Now between the arachnoid matter and the pia mater, there is a space which is called as the subarachnoid space. And from here, we are able to draw something called as the cerebrospinal fluid, which bathes the entire brain as well as the spinal cord. Generally, all procedures in children are done under a short sedation or a very short acting anesthesia. So the child needs to be fasting anywhere from 2 to 6 hours prior or before the procedure. Doctors will ask you for a consent, that means that you are agreeing to do this procedure. After which the child is put on his side, in the procedure room, and the child is made to curl up like a cat. This exposes the vertebral column and the spaces between the vertebra. We then clear up or clear out the area using antiseptics. Then a very tiny local injection is given so that the child needs lesser sedation. Thereafter, a very thin needle is inserted in between the two spinal processes, between the two vertebrae, and this needle goes right up to the subarachnoid space. The CSF then starts dripping out, and this is allowed to drop out or drip out drop by drop into a sterile container. This CSF is sent for analysis to the laboratory. The doctor may choose to give an intrathecal injection at this time. After finishing this, the injection, we would then just put some little bit of pressure as well as a dressing. Which are the drugs which are given during the intrathecal injection? The commonest is Methotrexate. Sometimes if there are cancer cells at diagnosis or we find them later on, we give triple intrathecal therapy, which includes cytosine arabinoside, methotrexate and hydrocortisone. What care do you as parents have to take after an intrathecal injection? Well, the child should continue not to eat anything for at least 3-4 hours or the time specified by your doctor. Keep the child sleeping or resting for at least half an hour to 1 hour. If possible, give a head-low position. That means the head should be lower than the body. Even if that is not possible, the child should be sleeping or resting so that the medicine goes all over the spinal cord as well as the brain and back. So this is very important. If you see that the child has fever, severe headache, the child is vomiting, is uncomfortable, is irritable, in that case you need to talk to your doctor immediately after a procedure. There may be some amount of local pain, but beyond that, there should not be anything. Friends, I hope this video was useful and I hope it helped you clear some of your doubts and answer some of your questions. Please understand that this is only an educational initiative and it cannot replace the advice given by your doctor. So please be in touch with your doctor at all times. Please feel free to share this video with anybody you feel who may benefit from it. And also, if there are any other topics that you are interested in, please do write it in the chat box. We will try and make videos on those. In addition, there is a lot of other information on pediatric oncology available on this channel. So please feel free to go through it. Thank you so much for watching.